We separate them in two categories. We have the ones that the controllable risk factors and then the uncontrollable risk factors. Uncontrollable risk factors are your age, heredity, sex. Really can't do a whole lot to change that. So if an individual has a family history of heart disease, starting for men, if they're someone at the age of 45 started with having a heart attack, then they are at a risk of possibly developing cardiovascular disease. If they have a female in their family that's developed cardiac disease after the age of 50, around the age of 55, then they too have a risk of developing cardiovascular disease. The controllable risk factors are your blood pressure. Control your blood pressure. We do follow the American Heart Association standards of trying to keep a resting blood pressure of 130/80 or lower. Exercise, regular exercise. If you have a sedentary lifestyle, unfortunately, that leads you to possibly developing cardiovascular disease. So you want to try to exercise about 150 minutes a week. Research has shown that if you are able to comply with that, then you do have a risk of developing cardiovascular disease. Cholesterol levels.
But a lot of people do look back and say they had some warning signs. But I think a lot of it's about prevention. Getting your physical every year, knowing what your cholesterol is, knowing what your weight is, being reminded that you should be exercising. So someone who's at risk, if your dad had a heart attack at 45, you should be getting your checkups, and your doctor should know your history. You should probably have a stress test, maybe some cholesterol levels. Yeah. We see a lot of prevention as preventing people from coming to us. Cardiac arrest means someone's heart actually stopped, they dropped dead, they fell on the ground and needed CPR, the end of their life if something doesn't change, like people doing CPR on them. A heart attack means that an artery got blocked up, causing you to have chest pain that hopefully sent you to the hospital, which resulted in an intervention that saved your life. So there are two very different things that people tend to use them as the same term.
Tell me about the rehabilitation program.
It's a medically monitored supervised exercise program where patients come in and exercise in a supervised, monitored environment with health professionals. We have registered nurses, exercise physiologists. They work as an interdisciplinary team to care for these patients. And we often see patients after they've had heart attacks, after they've had possible bypass surgery, valve replacement repair, stable angina. We see patients that have that diagnosis. Also, did I say valve replacement repair? We see some heart transplants, heart failure patients. Depression is a big component for people that either have chronic heart disease or have a diagnosis of heart disease. Yes, depression is a big component.
And it's like post-traumatic stress disorder. New patients, we've had them in our offices when I always like to ask the patient to tell me their story, what happened, and how many times I've seen tears, because it's quite an event to go through, feeling like that elephant's on your chest, thinking that, I may not see my grandchildren tomorrow. This may be it. Being told that you need open heart surgery and that your heart's weak, or that you're going to need this and that and take 6 new pills. There is a lot of mental stress that goes along with it, and the depression is true. I mean, that the psychosocial support those patients get is unbelievable. Not only do they get to talk to us and they just kind of unload, if you will, everything that's been going on. I mean, they've had every kind of specialist into their hospital room. They've been given a discharge instructions that are probably 12 pages long and sent home the next day. And then we get a phone. We call them on the phone and invite them in for an appointment, and they just soak up all the attention we give them. Then we take them out and introduce them to the other patients who've had the same thing happen to them. So when they come in for their exercise sessions, when we first meet them, we get an idea of what their abilities are. I do want to know if they've had hip replacements, knee replacements, how bad their back is. Dealing with an older population sometimes gives us extra challenges. So we have certain machines that we think are our core machines. All new patients are on a heart monitor, at least for the first visit, sometimes many more visits after that, depending on how they're coming into the program. We gently introduce them to exercise. Some people have never ridden a bicycle. Some of our older ladies who have always supported their families at home have not been on exercise equipment before. And some men, the only experience they want to talk about is the treadmill that the doctor almost killed them on. But we do get them back on all the exercise equipment at really light levels, and we supervise how much they progress. So everyone has an exercise prescription that tells us how long, how hard, how far, and what parameters that we're going to follow. Yeah. And so the exercise prescription is under the medical director, who helps us complete those documents and keep all that straight. Walking is equivalent to quality of life. If you can't walk, your quality of life is not good. So if we can keep people mobile and moving, just in a basic human way, that's a success. But it does promote cardiovascular fitness. I mean, really, we are here to make the heart strong. So exercise, walking is definitely number one. We shoot for 30 minutes 5 times a week. That's our goal, to get 150 minutes in. Moderate level. So we do encourage people to be able to walk quickly enough that they feel a little out of breath. Yeah. I mean, if you can carry on a conversation and not feel winded at all, then you're probably not walking fast enough. Right. It's because we're there to support them so that they know they're doing it safely. They know that if we're watching their heart and we're telling them it's okay to go a little harder, we're checking their blood pressure, their oxygen level if we need to, it instills the confidence for them to go out and do it.
I see.
Yeah. And so the next thing he's going to do is he's supposed to be starting some short sprints outdoors, which is a little more difficult than the treadmill. And then he's going to report back to us.
I feel like one of the biggest benefits for patients that participate with cardiac rehab is they gain the confidence to be able to take care of themselves with this new diagnosis of heart disease.
Yeah.